Now I'd like to show you a suturing technique that you'll find yourself doing. That's the sub-Q stitch. Now just envision this as the skin surface. And there will be times when you do a suture that you feel like you need to do subcutaneous stitches. Now what you'll usually use is either a vicryl or you may use a Dexon, and those will be the most common that you use, often a 5/0 vicryl, 5/0 Dexon. And this, I believe, is Dexon. So when you go sub-Q, you go underneath the skin, this being the skin surface, this being the edge, and this being the subcutaneous tissue. So you'll go underneath the skin, and you can go as far as the intracuticular surface. You can go that far. And you want to just grab the tissue and always make sure you didn't puncture the skin, because if you got too close, if you pull there, the skin will pucker. Now you need to keep your stitches on the same side, and then you want to come here on this other side and do the same thing, just in reverse. Okay, and so you want to, there's a couple things I want you to notice here. One is that the stitches are, the ends of the stitch are on the same side. And number two, that if you notice, your knot will be buried here. You want to bury your knot. Okay, so if you look here, maybe hard to see, but here's the top of the stitch, and then the bottom is where the knot is. You want that knot buried. And we'll try to demonstrate that one more time. And in order to bury that knot, we usually think when you do your stitch, say you're right-handed, you usually start over here when you're sewing things together. To bury the knot, you have to come over here, go in here, and then out the other side, or down the other side. And you also want to keep these suture ends on the same side. If you don't, you'll find yourself, say for example, if you find it like that, when you try to tie the knot, they'll cross over and this knot will end up being on top. So you don't want to do that. Occasionally, when you do these stitches, you'll find the need or the occasion to what we call backhand your stitch, and so you'll start on the same side as your dominant hand that you're using. Hold that a second. Now what you might find occasionally is the need to backhand a stitch. So this is how you're normally going to have your needle hold loaded, but then occasionally you may find the need to backhand, and what that means is you load the needle backwards from what you would normally do and start subcutaneously on the same side as the side that you're using. So the right side if it's your right hand and the left if you're doing this left-handed. and then go subcutaneously again. Pull it out. And see there, you'll have, when you tie that off, you will have your knot buried, which is what you want. A couple of things I'll mention about anesthesia and injecting lidocaine. Always inject with your bevel up, and when you inject painfully slow, just very, very slow, and that will allow the patient to get numb slowly as you go. Also, when you enter the skin, I always recommend that you tint the skin, make it a little bit tighter so you can pop through the skin quickly, rather than if it's loose. And for example, the skin is loose, it'll give, and all during that time that it's giving, that's pain. Whereas if you tighten it, if you pull it and tighten it, then it'll pop through. So I recommend that. And there's various diversion techniques, always talking to the patient. You can scratch their skin, scratch it real good. You can rub a little alcohol. You might want to get the alcohol off because that will sting sometimes. So maybe rub it with alcohol, scratch it, wipe the alcohol off, tighten the skin, pop it through quick, use some diversion techniques, and inject it very slowly. Thank you for watching this video, and we'll be looking forward to seeing you again soon.